Hi, everyone. Thanks for tuning into Health Podcast Show, the place to be to get the insights of leaders working at the intersection of health, science, and media. I'm your host, Dan Kendall, and this episode features a recording from the 2025 Health Podcast Summit, which was held on October 1st and 2nd. In total, we interviewed 42 speakers in 37 sessions that span topics across health, science, policy, and podcasting. You can wait to get access to all the sessions as we publish them here on your favorite platform, or you can get access to all the recordings, links, and resources by visiting our website at healthpodcast.org. Again, that's healthpodcast.org. Enjoy the show. Welcome to Health Podcast Summit, and thank you for joining me for this opening session. I'm excited to start with Dr. Aaron Carroll, whose experience perfectly captures one of the main themes of what the Health Podcast Summit is all about. As president of AcademyHealth and creator of Healthcare Triage, he's been using video and podcasts to communicate complex health research for over a decade. But during the pandemic, he discovered something crucial about why traditional health communications fails and why long-form content like podcasts might be our best hope for rebuilding trust. Dr. Carroll explains how pandemic messaging taught him that most healthcare communication treats skepticism as a knowledge problem, when the real issues are often about trade-offs and trust. You'll hear why giving people more information can actually backfire, how he separates science from policy in his content, and his strategy for using transparency and uncertainty to build credibility over time. This is exactly the kind of insight that can transform how all of us approach health podcasting. I just want to take a moment to thank all of our sponsors and partners who help make Health Podcast Summit possible. A special thanks to our gold sponsor, BetterHelp, and our silver sponsor, ZS. Please visit healthpodcastsummit.com for links to all these organizations and special offers. Let's dive into our opening keynote with Dr. Aaron Carroll, President and CEO of AcademyHealth. Dr. Carroll, thank you so much for joining me here at Health Podcast Summit.
No, thanks so much for having me.
Dr. Carroll, you actually give me permission to call you Aaron.
Absolutely.
Aaron, let me ask you, for just to level set for the audience, you are the president and CEO of AcademyHealth. So just for everyone's knowledge, just to make sure we're all on the same page about your role there at Academy, what does AcademyHealth actually do?
So our mission is to promote the creation and use of data and evidence to improve health and healthcare for all.
Perfect. Sounds like exactly aligned with what we're trying to do by sharing content through this medium and trying to reach the soft tissue between people's ears, I like to say. Yeah. And you're a pediatrician, you're a content creator. Yep. Your content that we're going to talk about, Healthcare Triage, actually predates your role at AcademyHealth by quite a bit. It actually started back in 2013. What was that was also the year that the Affordable Care Act launched. So were those two things coincidental, or was there a tie-in between why you started creating the YouTube channel and that event in healthcare?
No, in fact, they're intimately linked. So I was completely sort of oblivious to YouTube. I at the time had a blog where we wrote about using data and evidence to improve healthcare decisions like the Affordable Care Act. And a much more famous content creator named John Green actually did a Vlogbrothers video on why healthcare costs so much in the United States. And I think he did that because they knew the Affordable Care Act was coming up. And he got a lot of his information with attribution from our blog. And someone hooked us up on Twitter. We realized both of us lived in Indianapolis, and he asked if he could buy me a cup of coffee. You don't say no to that. And so I did. And my ask for that meeting was going to be, maybe we could do a few more episodes, or I could help write some scripts about healthcare. But instead he said, we're interested in starting a whole show on research and data and healthcare. And I thought that was fantastic. And so we had planned to start in 2014, but with the exchanges and lots of big things happening in October of 2013, we really wanted to get things started right about then. And so I think our first episode happened to be October 1st, 2013, which was the day the exchanges opened.
A lot of people in the audience are thinking about podcasts and using podcasts and already creating podcasts, and they're thinking about it in an audio forward or audio first format. And then they're also wondering what the role of video and YouTube has in it. You started actually with YouTube and video, and then you went on to create podcasts and audio forward, audio first content. So tell us first of all about your journey with video, because 2013 was quite early, still in the days of YouTube. How have things changed during the over a decade that you've been creating YouTube?
Well, when I first started, YouTube seemed to be sort of the sweet spot for what we were trying to go for, because we wanted our show to not just be about us telling you what you should know about health or research, but to really explain why we thought these things were true. And it really involved getting into a little bit more of the weeds about research and data, and to understand, what constituted good research, what didn't, why we should look at all things together and not just cherry pick. And so, 6 minutes, which was sort of our sweet spot for videos, seemed perfect. And it allowed us to do enough storytelling and enough sort of personality things, to sort of get to know us while still being able to be concise and get across all the information. There were competing products at the time, like Vines were getting really popular, but they were just too short. You couldn't do what we needed to do that quickly. In fact, as TikTok even rose, we felt the same thing. I could tell you what, but I couldn't explain the why. And that's, I think, one of the reasons we've even still at this point not been so great about moving over to TikTok. YouTube still fills that void. But over time, you start to realize that there are, times and things you want to talk about where even 6 minutes aren't enough, where you really need enough space to get into the depth of whatever topic you're discussing. And there are just very few media forms out there these days that allow for that kind of long form discussion. It's really just podcasts. And so when we wanted to have a really more in-depth discussion with a guest, which we didn't do on YouTube, or we really wanted to be able to explore lots of voices and thoughts in a topic, the only way to really do that was with a podcast.
You mentioned Vines there. That's really going back quite a while.
Yeah.
So those were 6 seconds, I believe, from recollection.
Okay, so those were short.
Yeah, those were really short. Your videos, your YouTube videos are about 6 minutes, you said, which is still 2 or 3 times longer than a lot of TV segments.
Yeah.
And I think that's really the thing that we're focusing on here in the Health Podcast Summit, is that mainstream media is still very short, where they give you a few minutes, maybe on a panel or maybe in a direct interview, to explain something for an audience. And it's really hard to get that into a 2 or 3 minute clip. The social media, TikTok and Reels, yeah, okay, maybe you can do 2-3 minutes now. You can do things live, but it really still isn't the format where you can engage with that soft tissue between people's ears and in the places and spaces where they're living their lives. And that's where I think the audio first, or the audio forward component, really begins to do the heavy lifting, where you can then spend time in people's cars and in people's kitchens. And actually, before we started recording, you actually mentioned that you don't particularly listen to music in the car yourself, but you do listen to audiobooks, and podcasts were a part of that. So have you seen a change in your audience or in the impact of your content as you've gone from a video forward onto platforms that include both video and an audio forward messaging technique?
I think that each sort of media form reaches a different audience, and it's important to try them out for their strengths and weaknesses. But I think, depending upon what age group you're trying to reach, depending upon exactly what kind of audience you're trying to reach, depending upon what your sort of use case is and what you're trying to achieve, you might change your format. I used to write pretty regularly for the New York Times. I knew sort of what the average New York Times reader would look like, but then I could take those columns and turn them into scripts for Healthcare Triage, which reached a completely different audience. Then if we decided to, turn that into something that might be more of a podcast, I knew that was a different audience. And since our goal was to try to reach as many audiences as possible, we were willing to experiment with all of these. But when the pandemic hit, I think is when I really started to feel differently about a variety of different media. It's when I really started to get down on cable news, as you mentioned, because while I'd be asked to sort of appear as an expert on a variety of cable shows as the pandemic really started to kick into gear in March and April of 2020, I realized, as you said, I would be one of 5 guests on a panel. It'd be me. It would be, someone, from government. It would be 1 or 2 of their regular pundits, a comedian. And while I would be really geared up to go on there and drop knowledge, the questions would be, for me, like the most basic ones, like, is it hard to be in an emergency room when COVID is happening? And I'd say, yeah. And then they'd move on to the next guest. And I'd be like, what am I here for? And you can really only talk in sound bites. There really isn't time to really get in depth into a lot of conversations. And the biggest problem is that there's no way to build trust. The only way to build trust over time is to really be willing to listen, to really be willing to engage, to really be willing to explain yourself and how views have changed over time. That's very impossible to do, first of all, in cable news. It's also very hard to do in short videos because if you spend all your time talking about the past, you don't have time to talk about the future. It was really only in podcasts that I could have enough space to really explain myself. I remember doing a podcast, I think it was in April of 2020. I think it might have been Slate, but it was talking about masks. And this is pretty early in the pandemic, and talking about how the guidance had just changed on that. While we had not been recommending masks in the past, now all of a sudden cloth masks were being recommended to prevent transmission from you to someone else. And how do you explain the difference in that kind of messaging, where first it was focused on you're wearing a mask to protect yourself, and that's much more important for people in high-risk situations, and they need very high-quality masks, where this was, okay, really what we're talking about is preventing asymptomatic transmission from me to someone else, not necessarily protecting myself, and that might require a lower quality mask, or a cloth mask might be just fine for that. But that still wasn't providing you protection. So you shouldn't feel any safer going out if you're wearing that cloth mask. I mean, this is complicated. Even just what I did is probably confusing. It required the ability to talk about that and almost nothing else for a good 20 to 30 minutes. And there are almost no ways to do that absent podcasts these days.
I think that example you just gave about the masks is probably one of the root causes of a lot of the distrust that we see today, and that has built up over the past 5 or 6 years. The fact that the guidance was changing, the fact that there was so little data that explained why masks were effective. I remember I used to work in the operating room. I used to go in as a sales rep and be there during surgeries, and we wore masks. And I was told during training that, hey, you're protecting the environment from what's coming out of your mouth while you're speaking. So when you're hovering over the surgical table and trying to explain something to the nurse or the PA or the surgeon, you're trying to keep your germs to yourself. It's not to protect you from what's happening in the room and that sort of thing. So I was surprised at how little data there was actually around the use of masks. And then obviously we had to sort of study it in real time while we were also trying to study this disease, which I think really led to a lot of the breakdown in trust, saying, well, you scientists don't really know what you're talking about.
Well, it's also because there just isn't enough room to explain yourself. If you go on cable news or if you go to social media, it's just one-way blasts of short bits of information. So your messaging went from, you don't need a mask, you're taking a mask away from a first-line, worker who needs it, don't wear a mask, to, okay, wait a minute, wear a mask. But now it's not about protecting you, it's about protecting someone else, and you can wear any mask you want, but still don't get the N95, still don't take the high quality mask away from the frontline worker, but put on a lesser mask, which now sounds like we're saying you don't count as much. But the difference between wearing a mask to protect you and wearing a mask to protect someone else from you is complicated. The idea that a different quality mask might be necessary for those two things is complicated. The understanding of, when you might need to wear a mask or who might need to wear a mask can be complicated. And then throwing all of this in by just saying, like, wear a mask, this is what science says. When what does science say? Does it really say this? And, sort of saying, and then it got into the line of, like, people were like, well, wear a mask, it's just so easy. I hated when people said that. I wear glasses. Wearing a mask was torture in the sense of, like, I could never see. It always clouded my glasses up. I couldn't see who I was talking to. I couldn't see if I was dealing with others or whoever it was. It was difficult. And I didn't like every time someone told me it didn't matter, just do it, because I felt like it was ignoring that it was a real problem for me and that I couldn't see. I did it because I knew it was the right thing to do, and I did it because I knew I was protecting others, but I didn't appreciate the way that people would often say it, as if, like, science says this is easy, science says this is nothing, science says go. Science says none of those things.
Yeah.
Science told us that probably wearing a mask might lower the risk of my transmitting COVID to someone else if I had it and didn't know. But we don't know how much, we don't know for how long, we don't know what the real difference is, and probably we should err on the side of safety. that message got lost. We just dropped things into sound bites and tweets and TikToks, and that doesn't persuade anyone who doesn't already agree with you or doesn't trust you.
So you're there now at Academy Health, which really prioritizes the evidence and data and the application of that in healthcare. And we talked on our previous conversation around some of these issues around trust and how we seem to treat the lack of trust as really a knowledge deficit problem.
Yeah.
Can you explain more about that?
Yeah. And so one of my, when I get on a rant about this, one of the things I say all the time is if you follow the change management literature, there's a lot of thought that there are 3 reasons that people resist change, or 3 reasons people might not do what you want them to do. The first is that they don't understand it. The second is that they don't like it. And the third is that they don't like you, which is really about trust. The problem with how we often treat health dissemination or science communication is we treat everything like it falls into that first bucket. It's just a knowledge dissemination problem. It's always assuming people don't understand what you're asking them to do. And the problem with that is that we think that just providing more information will get them to do what we want them to do. Again, a tweet, a cable news hit, a little video, the idea that I just tell you, look, this is what you should do. Now you should do it. It ignores completely that there's a second bucket of people who are utterly rational and reasonable. They understand what you're asking them to do, but they don't like it. I don't like wearing a mask. They don't like the trade-offs. It might cost too much. It might be too much of a burden. You're asking me to change my life in a way that makes me unhappy or difficult or something. And it's not that they don't understand. They just value the trade-offs of the decision different than you do. And in that case, dropping more knowledge on them doesn't do anything but make them think you're not listening to them and that you still don't understand them because they have real, and so many things in healthcare. Every decision in healthcare actually involves a trade-off. There's a plus and a minus. There's a benefit and a harm. And we understand that people make very different decisions about their health depending upon their risk profile and what they value. And that's okay. But often in our science communication, we don't do that. We just think, tell them more, tell them more, tell them more. It also completely ignores the third bucket of people that don't trust you. And if people don't trust you, research shows that actually providing corrective or more information actually hardens them against you. People who think that the flu shot causes the flu, if you drop CDC knowledge on them saying that that's absolutely not true, it actually makes them less likely to get vaccinated. Science shows that. When people thought death panels were a thing during the Affordable Care Act, providing them corrective information when they didn't trust you made them more likely to believe that death panels were a real thing. We ignore that completely. We take a group of people who already don't trust us, and once again, we think that just yelling at them or dropping more tweets or social media or videos on them is the way to change their minds. That's not going to happen. That third group needs a rebuilding of trust, and that can only happen over long periods of time with constant engagement and two-way discussions, which only happen again on podcasts. And so if we want to find a way to dispense knowledge, but also be willing to engage in honest discussions about trade-offs and what might be good and bad about certain decisions and build trust with our audience, there just aren't a lot of ways to do that in media anymore. This happens to be one of the few.
So people are going to think you're a plant here, like I've coached you with all these things, because these are all things that I say, having been a podcast listener since 2005 and a podcast creator since 2016. And really, that's the reason we're doing this summit, is to try to elevate, amplify, and demystify the use of audio and podcasts in communicating health information. You just talked about the change management sort of idea about why people don't respond to this information. And we talk louder, we dump more science. What is the counterpoint to that? What do you do? Podcasts, yeah, that can be the medium, but what are you doing in practice that happens to be on podcasts? But what are some of the things that you're doing?
Well, broadly, as Academy Health, broadly, I think a lot of the things we do are try, first of all, to engage with people who don't agree with us all the time, to really try to build that kind of audience. We try to be very careful about separating science from policy, because science has, sort of a set of rules and ways that we all go about doing things to help us get more sure about understanding how the world works. Policy, on the other hand, takes good science, but it involves applying a societal lens. What are preferences of people? What are their trade-offs? How much might this cost? What are the harms that might come from it? So you could take the same science and in different areas or amongst different groups, create different policy. That absolutely makes sense. I think what we often do is we conflate the two. We say, okay, we say follow the science. We say, here's science. That means this should be the policy. That's not always the case. And we're very careful to separate that because you have to acknowledge those trade-offs and you have to acknowledge that you can get to different places from the same set of science. And so making sure that the knowledge is one thing and that we treat that separately, then the trade-offs and the decisions that you might make in terms of policy, but also continuing to make sure that you're always listening and engaging in ways that build trust. That's how over the long term, you affect the most change in the right direction. And that requires a specific set of skills and a specific commitment to two-way conversation, to listen as hard as you speak, and to engage with people just as much as it is with information. It's hard, it's slow, but it's really the only way to build that real audience and have the best chance of, enacting the most change.
That sounds scary, frankly, to have
It's
some of those
hard.
conversations with some of the people who can be, looking at just entirely different, or just at least drawing different conclusions, even if they're not looking at different data. It can be scary in that a fear that I would have is platforming people and views that really, if people follow them, they may harm themselves, their family, the people they care about in their community by following some of this information. So how do you balance that as an organization and as a content creator? How do you balance that desire to listen, engage? Because these are people. We're all people. So how do we do that? And then also try to ensure that we're keeping a scientific lens and that we're trying to get to that conversation of, well, what are some of the core things that we can agree on and stand shoulder to shoulder instead of nose to nose?
So, first of all, there is you have to be honest. We can recognize that there are grifters out there, who are not trying to, achieve a better world. They are trying to make money or, just achieve fame. And they're willing to say whatever inflammatory thing that they might like in order to get to their goals. But they are not all the people that are out there. Most people are not like that. If you think about the people that you come into contact with all of the time on a daily basis, most people aren't trying to win at all costs and to crush you. They're just trying to make their lives better. I have found more often than not when we talk about, health and healthcare, you can find people on the fringes who really want to just make a buck. But most people engaged in the business of healthcare are trying to achieve a goal of a healthier, happier population. Recognizing that it's the outcomes we need to focus on and not how we get there, and trying to bring the temperature down and talk about the fact that there are a variety of ways to achieve the goals that we're looking for at a healthcare system level, which I deal with all the time. Lots of people want to reduce healthcare spending. Lots of people want to see the quality of healthcare go up. Lots of people want to see people have more access to the healthcare system. They disagree on how to get there. And we get so entrenched in our way is the best way that we just start fighting past each other, as opposed to saying, like, look, what's your main goal? Is it that you want to reduce spending? Because I can show you research that shows a ton of different ways to get there. And I can explain to you the trade-offs of all of those different decisions. What might be the good part? What might be the downside? And then you should all come together and decide which of these makes the most sense to you. And then you should go and sell that to the American people. That's not how our politics works. That's not how healthcare reform works. Instead, we get into entrenched battles about this way or that way. And those are like the only two choices available. And then we just fight. There are better ways to do this, but they again involve taking good science, being willing to talk about it in terms of trade-offs and, understanding that there are a variety of ways to get there, but also building trust that we're really all trying to get to the same place. Most of us, we really all do want a better healthcare system. Nobody wants a system that costs too much. Nobody wants a system that doesn't work. No one wants a system where you can't get what you need. Everyone wants the opposite. We just disagree on the how to get there. And refocusing that conversation, being able to engage the way we're doing right now, is the way to do it. But there are just so few ways these days to get there.
It's a lot about values. I try to really look at the values of people. So when we look at the shared values of what are they trying to get to, and if we can focus on that, instead of the verdicts and the judgments that might have been passed about how we do that, we can look at trying to establish that common area to say we all want lower costs, more access, healthier food, healthier population, healthier family members, longer life, better health span. We all want those same things. So how do we stand together shoulder to shoulder in doing that?
I think, part of the problem is like also we just think everyone thinks there's a magic solution. Everyone thinks that there's some way to make access better, to make quality better, and to bring down spending at the same time. And they believe that because politicians tell them that all the time. And then it fails. Because look, if there was a way to do that, we would have done it already. The problem is it's all trade-offs. I can make your healthcare system better, but that probably costs more money. I can make access better, but that's probably going to cost money or quality is going to suffer. I can make things cheaper, but that either means not giving everybody what they want or, again, quality. Like they're just trade-offs. Which of those things is most important to you? Let's discuss a variety of ways to achieve that goal with understanding the pros and cons of doing so. And then let's, try to come to a decision that, reflects most the will of the people and then see how it goes. And obviously there are elections. And if we don't like how things are going, we have to try something else. But there is no magic solution. And until we're willing to accept that, and until we're willing to discuss the pros and cons and trade-offs of whatever decision we might make, we will be stuck. And without trust and continuing just to shout at each other our magic solutions that don't really exist, we're going to get nowhere.
Exactly. So it sounds like based on your positive comments about podcasts earlier in this conversation, it sounds like you're going to continue to utilize audio forward, audio first, screen light, screen free versions of content to be able to have this dialogue. Your video series has been going for a really long time. I really encourage people to go and check that out. We'll have notes to that in the show notes. I also saw that you have a Patreon that's available for people to support you. So while I know this isn't paying for your vacations and paying for your second home, I know I believe there's 4 of you that are working together to make this platform
most of it,
a reality.
Healthcare Triage is mostly a work of love of 4 people. Yes.
Yeah, exactly. So I know people can support you by going to the links in the notes of this conversation and finding ways to support you there. What are your plans for the podcast, and how does that differ with your plans for your video series? Is it still going to be around the conversation versus the narrative with the video?
I mean, I know that, both Academy Health and Healthcare Triage, we're trying to figure out ways to partner with others. We're trying to figure out ways to, put in the next perhaps year, hopefully, highlight some of the ways that recent changes have affected science and scientists. We want to highlight, the work that has been disrupted and try to talk about that there are real world implications for a lot of the ways that policy is being changed right now. We want to find ways to defend science and talk about how great science can be and perhaps how it could be better. And we want to find ways to work with others to elevate the dialogue to what we've been talking about here. Take a discussion about health and healthcare and be able to really get in depth to some of these very difficult decisions and explain to people how there really are trade-offs and that these situations and these solutions are not easy and they will require some sacrifice. And that in all of these decisions, there are likely some winners and some losers, and we have to accept that. And we have to try to minimize the losses while maximizing the wins. And recognize that these are hard decisions where there really are sometimes no perfect options, but we could be doing so much better if we could have better conversations about them.
So for anyone who's listening to this and might not have the video in front of them, where can people reach you? What should they look for yourself and your content, but also for the information at Academy Health?
Sure. Academy Health has a great blog, which continues to highlight a lot of the stuff that we do. We also have an email that we put out a couple times a week called the Situation Report that describes what's going on in Washington and what people need to know about it. You can just certainly go to Academy Health and subscribe to that. Healthcare Triage is easily found on YouTube and anywhere podcasts can be found. And we will continue to promote it on all of our social media, channels and everything else. And we're pretty easy to find.
Fantastic. Well, we'll make sure we make all that available. I really appreciate you spending time with us here at Health Podcast Summit. We really want to see organizations and leaders like you and yours really be successful in reaching people in their cars, kitchens, and commutes. So thanks for doing the work that you're doing. Is there anything you want the audience to know before I let you go?
No, I think this has been great. Thanks so much for doing this, and thanks so much for having me.
Excellent. Well, thank you for joining me, Dr. Carroll. We'll let you get back on with your day.
Thank you.